Hi, my name is Kara Kumari. I'm Assistant Commissioner of Communications and External Affairs for DIDD. Joining me today is Dr. Bruce Davis, Deputy Commissioner of Clinical Services. He's here to talk with everyone about DIDD and COVID-19, how this virus is spreading across the state, the country, and the world, and its impact on the DIDD community. Dr. Davis, thank you very much for joining us today.
Well, thank you, Kara. It's an honor to be interviewed by one of the best reporters that ever came out of Nashville.
That's very nice, and I appreciate that. First question is going to be kind of an overview question, just so we can kind of really set the stage here. What do people with intellectual and developmental disabilities and their families need to know about COVID-19 and its impact on people with disabilities?
Yeah, Kara. Well, one of the things I think that's really important for people to know is that it's a serious disease that can really have grave consequences for people with IDD. It's nothing to play around with. It's certainly a virus that can cause, for some people, pneumonia, severe pneumonia, which is basically a filling of the lungs with fluid that makes it very difficult to breathe, especially for people with respiratory disorders and other disorders that may cause their weakened immune system or a weakened ability to deal with physical stress. So it really, I think one of the most important things to understand, and these things are so simple, but they're very, very, very important, and that is to keep clean hands. And so that means washing your hands for 20 seconds, going in and out your fingers, going up and down your thumbs, doing your fingernails. All of those things are very important when you're washing your hands, doing it for 20 seconds each time that you do it. And it's such a simple thing, but it's probably the most critical thing that you're doing. The other thing is social distancing. So staying at least 6 feet away from other people when you're able to, and certainly if you go into a public setting where you're around people that you don't know, that you are staying at least 6 feet away. So that is a critical aspect of it. And, I think for people with disabilities, I really want to recommend that unless it is absolutely necessary, that they stay home. And so those are, I think, some of the most important things to prevent the infection. And I think that is the key, really, that we want to get across to people. And I just would like to speak directly to people that are served within our system right now and just say, look, I'm your friend. I am really here to support you and to help you. I want to say to you, it's really important for you to be part of your community right now. And what that means is that we need your help. We need your help in staying in and staying away from others for a period. And every responsible citizen is doing this now. We're staying in, we're minimizing our contact with others. And so to help each other, this is what we really need to do.
Those are all really, really important points, Dr. Davis. Thank you so much for hitting on them. One of the things we here at DIDD have had to do is respond very quickly and make many decisions very rapidly. Can you talk about some of the changes that DIDD has made to maintain services while ensuring the health and safety of the people we support?
Yes, and we have been busy, as you know, because we've been meeting every day to talk about these things, and we are tracking the testing for one thing. That is such an important part of what we're doing, and I want agencies to know we are not trying to horn in on your business or trying to find a way to find fault with what you've done, but we want to be able to reach out to you and assist you with knowing what to do if you are testing someone or if someone has had a positive COVID test, because the things you need to do under that circumstance are not easy. They're very complex strategies that you have to implement to make sure that you're doing that correctly and not risking infection of other people. So we've also partnered very closely with the Tennessee Department of Health. That has been a very good partnership up to this point. And I have had contacts there, been bouncing ideas off of them so that they can give us feedback about what we need to do. We're not epidemiologists. We're into serving people with IDD. So we rely heavily on their feedback and guidance, as well as the guidance that has come out of the Centers for Disease Control. So the Centers for Disease Control do this day in and day out every day. So we have relied very heavily on their guidance, we put out their long-term care guidelines, which are really, I think, the template for us to follow as we start to try to design COVID response plans within our agencies. So that has been very, very important. And I think we've done a pretty good job of disseminating some really important information from there, but also generating some of our own guidance under these circumstances, because it's not just knowing what you do in a long-term care facility, but it's also understanding the IDD population and being able to design strategies that are going to make those things work within our settings. And so we've tried to put out articles and other information, I think, that would be helpful there. We've also been working very closely with TEMA to try to address the personal protective equipment issue. Personal protective equipment is very important if you're working with a COVID positive patient or someone suspected of being COVID positive, meaning that they've had a test. And so we want to be able to provide that equipment. Everybody has heard that the equipment is not in great supply, that there is not a plethora of equipment out there, but we want to be able to provide as much of it as we can. We certainly may have to deal with a situation where we're not going to have as much equipment as we hoped, but we want to try to make the best of what we will have. And so we've been working very closely with TEMA to do that. Because these things are happening daily, and part of the reason we're tracking all of this information is so that we can learn from different situations that come up. And I can say that, you know, this is a learning process. As you go through dealing with a pandemic of this type, you have to learn about how the virus moves and how it moves from one person to another, and how people are responding to that, and so forth. And so as we get these reports back, each one that we get gives us more information so that we can give better information back to our providers. I did want to mention one other thing there. I'd be remiss if I did not mention, as I frequently. Yes, the Clinical Consultation Network is something that we do every week at 12:30 Central Time. And I really want to encourage people to watch or come on and be part of that Clinical Consultation Network. We do it 12:30 Central Time every Tuesday. And we've actually done a couple of additional sessions during this period where the coronavirus has been active. And so we have had a session that was on prevention, some of the things I was talking about a moment ago, like washing hands and how to get people with IDD involved in that. But then we also had a session on how to care for a COVID patient. And the good thing about it is we record every one of those sessions. Those are on our DIDD website that people could access at any time and listen to them. And I highly encourage people to do that, and highly encourage people to attend the live broadcast when they can.
And you mentioned some of the things that you guys have talked about on the Clinical Consultation Network. And one of those things, and I want to address it here, is what should providers and direct support professionals do if a person they support develops symptoms of COVID-19?
Right. Well, so the first thing you need to do is report that to your healthcare provider. So if you have a primary care physician or someone else that is providing primary care, whether it be a nurse practitioner, whoever it may be, you need to report it to them, make sure that you follow their instructions. And that is, above all, that is something that you need to do. What they're likely going to do is, if the person meets the criteria, has the appropriate symptoms, they're going to order a test. And so that test will be conducted. And it's at that point that you really need to start taking precautions about how you intersect with the person, how you treat them, that you do either what we call an in-home isolation, where they go to their room and the door's closed and they have their own bathroom that they're not sharing with anybody else, and that they maybe have one staff member under that circumstance, and that staff member is wearing the personal protective equipment that they have to protect themselves. But also, it's very important for the person supported, the person infected, to wear a mask to prevent the droplets from going into the air and being breathed in by someone else. So these things are really important things to consider whenever you have that. There's also a Department of Health COVID information line, which I want to make people aware of. That is something that you can call anytime between 10 a.m. and 10 p.m. at night, and you can get your questions answered in real time by a professional. And so their number is 833-556-2476. I have another number at 877-857-2945. And so if you call them and tell them about what you're dealing with, they can give you real-time guidance to help you.
All right, so we've talked about if a person develops symptoms. So let's move from suspected to positive and confirmed COVID-19. If that person is in a supported living situation, what are some of the things that can be done to minimize?
A couple things to think about. One is that they really, I think actually this is something good to do even before, but especially after you've gotten a positive test, that you're going to adjust your staffing, because the thing you want to do is minimize the number of people who are coming into contact with that person. It's of critical importance that you start to limit the number of people who are going to risk essentially getting a COVID infection. And so that way you also are maximizing the use of whatever protective equipment you have, because you're not having to outfit several people, but really one person under that circumstance. And that's actually a good strategy even before you get a COVID test. I've heard of some agencies that are doing sort of a live-in scenario where there's someone there who is, basically just staying with the person all the time. And I think we've been able to secure some different flexibility for people and being able to establish different sorts of scenarios for staffing. That's very, very important, because that way we can limit the number of people that they're coming into contact with. And even if it has to be 2 staff that are serving someone across the day, that's better than 8 staff. And then there really doesn't need to be any sharing across homes of staff during this period. I would suggest for this entire period to keep those situations very limited, such that staff are working in one home.
I know you're a big preparation guy. Before we get to this point, before we get to symptoms, before we get to a positive case, what are the things that people can do right now to help them prepare in the eventuality or the case that they may have someone they know or who lives in the home who has COVID-19?
Right. Well, I want them to get a complement of protective equipment that they could have on hand to be able to respond when this situation comes up. Because if you are having to procure that after you discover the case, you're losing very valuable time in preventing the spread of the disorder. So it's very important to have that equipment on hand. We have established a form stack request method on the DIDD website, and I encourage agencies to go in and to make those requests for that protective equipment so we can have a record of what they need. I'm not guaranteeing that we're going to be able to fulfill all of those needs, but we want to have a good understanding of what is needed so that we can try to procure that. And so what I've encouraged agencies to do is to look at a typical case scenario where a person might have to be treated as a COVID patient for 21 days. And under that scenario, they need to have 300, I'm going to just go ahead and give you the straight numbers here. You need to have 378 masks, because you need 9 per day for the person, and you need 9 per day for 3 shifts of staff that are on there. You need 189 isolation gowns, exam gloves, and footwear to protect your feet, to prevent from getting coronavirus on your shoes and on your feet. And so those items, you need 189 each of those. And then you need, for each staff member that's working with a COVID patient, you need a face shield. So you've seen these plastic face shields that people are wearing. You need one of those. It needs to be disinfected every time you change your equipment, but also does not need to be shared among staff. So everybody needs their own face shield. Those are things that you need to do to prepare in case you have a positive COVID case.
Dr. Davis, is there anything else that you would like the DIDD community to know about COVID-19 or the state of emergency?
Yeah, there are a few things I want to say here, and this is this is a stressful situation for everybody. I think I will just say it's stressful for me to deal with some of these things that are going on right now. I think it's certainly an unprecedented time. I can't imagine. I can't remember any time during my lifetime that we've had such a significant event where people have been asked to change their life in such a significant way. And so I'm very confident, though, in people with disabilities. And when they are called upon to help in a situation like this, they always respond. They want to be asked for help. And part of the reason they like to help is because they are so often having to be helped by others, and they relish the opportunity to help. And when you can frame this and explain and teach them in that context, I think you have a great chance of enlisting their support in doing the things that are necessary, washing their hands, doing the social distancing, other things that are necessary. I have very great confidence that people with disabilities will play this role in their community. That's the way I think I want to frame that. One more thing, if we do our due diligence together, we can get through this. There is going to be some pain in this. I don't want to sugarcoat the situation we're in. This is a difficult situation. There will be pain, there will be loss. We will have to work through those situations, and people are going to experience stress. But stress is not a thing that has to be a negative. It can be a positive. We can turn that stress into doing our due diligence and doing the very best we can to try to get past this thing and to not blame one another. I think that's such a key part of it, because when you get into this situation, there's a lot of stress. People are wanting to blame other people who are in close proximity to them. This is just part of the way we operate. But if we can overcome that, and if we can be positive in the way that we approach this, we can have the best outcome possible.
All right, thank you very much for joining us today, Dr. Davis. Before we wrap up, I want to first of all let people know that if they have concerns about DIDD's response or things that they want to know about services and supports, there are two ways they can reach out. First, they can either go to the COVID-19 page on the DIDD website, and you'll find a wealth of information on that page, including that PPE request form that Dr. Davis just talked about. Also, we've established an inbox because we want to hear those questions and concerns. That inbox is dedicated to COVID-19 questions. The address is didd.covid19@tn.gov. We hope that everyone has found this to be useful today, and we look forward to talking to you more. Thank you.